Hi, my name is Dr. Jordan Fursell. I'm a pain management specialist and author of the book, When Bad Backs Happen to Good People. Today I'd like to discuss with you what is the utility of diagnostic testing for chronic painful conditions. Classically, at least over the last 25, 30 years, patients that have had chronic pain, we have been able to look at their spines and other structures in the body in order to ascertain if there's any structural damage. And that is the main utility of CAT scans and MRI scans. That is that we are able to see if discs are out of their normal place, if discs are pressing on nerves, if there's arthritis. And what's been found over the last 20 years or so, since we've gotten this level of sophistication in imaging, is that there's not a direct correlation between somebody having an abnormality of the spine and feeling pain. In other words, there's not a one-to-one relationship between having a herniated disc and having pain in your neck or in your back. So it always amuses me when patients come in the office and they say, well, you know, I have 3 bulging discs in my neck and a couple of herniated discs and another 3 bulging discs in my back. And what I tell them is that the studies in the medical literature have shown that approximately 50% of people that have herniated or bulging discs actually are walking around with absolutely no pain. So I think what we can say about the imaging tests as they are constituted today is that they give some indication that there has been damage in the area of the spine of the disc, and the disc is actually a shock absorber, so that it will get disrupted if there is very significant forces acting on it, especially in flexion, where the disc will actually extrude backwards, and that's what you see in many cases when there's a herniated disc and perhaps some pressure on the nerve roots. What I found to be a little bit more significant in looking at MRI and CAT scans is there any evidence of arthritis? Because arthritis is actual inflammation that can be detected, and sometimes that can be responsible for pain or irritation of a nerve root. But the problem with MRIs and CAT scans is that it is impossible for us to say with any given disc, with any given patient, that there's a one-to-one correlation between their pain and the abnormalities on the MRI scan. And in fact, the MRI scan may be a good marker for where damage occurred, but there may be other causes for the damage that we will discuss in other videos. My name is Dr. Jordan Fursell. Thank you for listening.